I think a lot of you know the story that Mila ended up becoming the first person to receive a drug tailored to one person. That's not what I set out to do. I just set out to try to save my daughter. And it went from Batten focused to suddenly, once Mila was treated, realizing together with Dr. Tim Yu from Boston Children's, who designed and pioneered this drug, that this was potentially a platform solution that could solve what I would like to continue calling a global health crisis, which is rare disease. And I'm never sure why people don't call it that, because it's bigger, as we've learned, than HIV and AIDS and cancer combined. And so a platform solution is needed, and I started learning that this was potentially going to be an impactful solution to this. And one of the ways to get there was going to be to start with Mila's data, her preclinical and clinical data around Milacin, her drug, and also all the data around the actual process itself of how do we create individualized medicines that hadn't been done before. And so I just realized that if we don't start somewhere and collect this data and start collecting every data, instead of having siloed data for each individual patient and each individual disease, we have to put it in a place where we can have learnings. And unfortunately, data sits in drawers of academics, often, not always, and it sits behind closed doors of companies, unfortunately. And so one of the things that will be discussed, I'll discuss it in this panel a little bit, and then Winston Yan, who runs the NF1 Collaborative that I helped start last year with Tim Yu and many others, is a great place to have a neutral hub exactly for that. So the center of that is starting with Mila's data, is collecting data in a transparent way that is available for everyone so that we can scale this. Otherwise, we're going to be here in these orange chairs in like 2,000 years still talking about how we're going to solve rare disease.